Hi everyone. Sorry for the delay. We are having some slight sound issues. I hope you can hear me okay. It worked so far. Um, well, first of all, welcome to this session 2 of the Waters Webinar Week, focusing on innovations and applications for the clinical workflow. I am Gode Bosch, and I am your host for this session. Before we get into the presentation, and I'm sorry for the repeat for the people who were on the previous session, I have to repeat things. I'd like to share a few practical details. So at the bottom of your screen, we have loaded some material, some documents, some links as well to some web pages that we felt are useful and related to the topic of today. On the top left, you have a box that you can use to type your questions. And we very much would like you to type in your questions. And we'll answer them towards the end when we reach the Q&A session. And on the right, you have 3 questions, I believe, which are a short survey in a way, to help us get better at doing these webinars. So it's kind of a feedback, and as well it allows you to express some wishes in terms of topics and things you would like to see from us. Our presenter today is Jonathan Danasso. He's a principal scientist in the clinical business unit created roughly 18 months ago by Waters Corporation. So he gained a PhD in neuroscience from the University of Utah. And John came to Waters 12 years ago after spending several years in the forensics toxicology and sports doping field. Since joining Waters, John has focused on sample preparation, as well as LC-MS solutions for forensic, clinical research, as well as other bioanalytical applications. This presentation title is Efficient Sample Preparation, Educational Webinar on how to make sample prep steps easier and gain in efficiency. And now I pause, and I hope that we'll have some sound from John. We may have to be a bit patient until he gets the possibility to join. Would you mind typing in the chat box or in the question? Well, yeah, in the chat box if you can hear. No, the answer is no. So it's pretty clear now. I cannot hear John, and you cannot hear him. Okay, last hope. No, still not working. So yeah, while we wait for John to connect, which seems to be difficult, if you have any questions, I see one came in. If you have any questions, please type them in, and John will give the best answers he can to these questions. I guess we have a technical issue.
Can you hear me?
Oh, miracle.
Are we back?
Yes, yes, you're there.
Okay, wonderful. Well, thank you.
Okay.
All right, so we can get going, finally.
Yes.
All right.
Okay, well, I go to you. Take the lead.
Okay. Well, thank you, everyone, for your patience. I apologize for the technical difficulties. So as Godo said, my name is John Daniso, and I'd like to talk about sample preparation for clinical research applications. Usually at Waters, we get very excited about fancy boxes and cool columns. These are the usual stars of our show. But before we use these, we need to get our sample in a condition where it's appropriate to inject on an LC-MS system. And so today I'm going to focus on that. Before we get into sample prep, though, I do want to take a quick aside and talk about column selectivity. I'm not going to go into all of this, but I do want to emphasize that when we're dealing with things like matrix effects and ion suppression, chromatographic selectivity can have a dramatic effect on that. So it's more than just sample prep. A quick example of this is an assay where we were looking at serotonin, or 5-HT. If we look at the 3 chromatograms on the left with 3 different columns, HSS, a BEH, and a PFP, we say they all get pretty good separation, especially the last 2. If we look the last 2, we would say they both be fine. We may as well take the BEH, but taking a look at the matrix effects associated with that, we see that in this case, the PFP column significantly reduced matrix effects, ion suppression compared to the other 2. So again, I just wanted to emphasize that when we're looking to control things like matrix effects that we'll talk about later, if we have the selectivity, column selection can be a tool as well. So to launch into what we'll be talking about today, getting started, we'll talk about sample matrices, their properties, and then the options, products, and protocols for different types of sample preparation. We then will talk about recovery and matrix effects. That's how we will evaluate our method. And then we'll get into sample pretreatment and extraction. Often before we do anything, perform a solid phase extraction or other sample preparation, we need to pre-treat the sample some way, deconjugate it, buffer it, etc. And then we'll look at some specific application examples of some of these concepts we cover. So when we're talking about clinical matrices, sort of the main ones usually are whole blood, urine, and then plasma or serum. And they each have different properties. Whole blood has a lot of blood cells, plasma and serum, a lot of protein and phospholipids as well. And in urine, we don't have as many proteins, but compounds can be conjugated. And there's a high concentration of salts and small polar compounds as well. When we look at clinical, when we're looking at clinical analytes, the properties are all over the place. We can have polar molecules such as catecholamines and metanephrines, or some of the water-soluble vitamins. We can also have very, very non-polar and lipophilic things like steroids and vitamin D, and some of the fat-soluble vitamins like vitamins A and E. There are compounds that are often looked at for therapeutic monitoring, such as antiarrhythmics and tricyclic antidepressants that are sort of in the middle. And of course, many of the toxicology drugs can be in the middle. So the analyte properties can be quite varied, and we need to consider both of the analyte and the matrix when we're developing a sample preparation strategy. So we'll go through a couple of poll questions. I will not spend a whole lot of time since we were a little bit delayed, but I'm going to ask a few of them. First is, what sort of sample prep do you currently use? And if you'd be kind enough to fill that out, we'll take a, I'd appreciate it. All right. The next question, for those of you that are not using SPE, is we're interested in what sort of what are the barriers that may be preventing your use? Is it too complex, expensive, time-consuming, something else? I guess I should have had we're using it and we're happy, but let us know, please. Even with the other one. And then finally, what are your primary concerns with sample preparation? Ease of use, cost, reliability, or cleanliness? All right. Well, we will come back to those later, to giving you guys some time. Now I'd like to start talking about different options, products, and protocols for sample preparation. So with any sample prep strategy, really the goal is the simplification of the sample matrix, basically cleaning it up, isolating our target analytes, and often as well, enrichment of those target analytes, get them in a higher concentration so we can see them. We see a number of methods down here from the left to the right. Basically, we're going from the simple, inexpensive, and easy to a bit more expensive, more complex, but also much more selective and specific. So it's really, we get to choose, we need to choose, what is fit for purpose for our assay. It may be that we got plenty of sensitivity, we're doing an initial screen so we can do protein precipitation. But if we want high sensitivity and a lot of specificity and sort of reliability for quantitative assays, often we may want to go a little more specific and a little more selective for things like solid phase extraction as well. Waters, we have a couple of main, I guess, focus areas of sample preparation. On the left, we have a couple of protein precipitation plates, such as Sirocco, which is a filter plate, and the Ostro plate, which is precipitation and phospholipid removal. And that's been very useful for a number of assays. When we're talking about more traditional trap and elute sample preparation, we have our OASIS family of sorbents. That includes OASIS HLB and OASIS HLB prime, which add phospholipid removal, as well as the mixed mode sorbents, the strong and weak cation exchangers. And additionally, we have OASIS MCX prime, which adds phospholipid removal to a strong mixed mode cation exchanger. So what is it, HLB? It is an easy-to-use water-wettable sorbent. HLB stands for hydrophilic lipophilic balanced copolymer. And as you can see on the left, we have these two monomers that are combined to create a polymer that is stable across a wide pH range. Gives us high recoveries for acids, bases, and neutrals. It's water wettable, so we can eliminate conditioning and equilibration steps, and we don't need to worry about it going dry in the middle of our extraction. And because of that, it won't dry out under vacuum or positive pressure once wetted. As I mentioned before, we have two reverse phase sorbents, HLB and Oasis Prime HLB, which adds phospholipid removal. And then we have our 5 mixed mode sorbents, including the strong and weak anion exchangers, MAX and WAX, Oasis MCX and WCX, the strong and weak cation exchangers, as I mentioned before, as well as Prime MCX, which adds a phospholipid removal protocol to the strong cation exchanger. Looking at the structure of these, as you can see, all the mixed mode sorbents are based on the original, on HLB, which we see in the middle, that copolymer we see in the middle with the hydrophilic and lipophilic retention, or lipophilic monomers in there. And you can see the functionalities that are added to the various mixed mode sorbents. The important thing to be aware of for many of these is, one, the pKa of the, in the case of the weak sorbents, of the sorbent itself. It's about 5 for the weak cation exchanger and about 6 for WAX, the anion exchanger. We also want to be aware of the ion exchange capacity. Often when we're dealing with urine samples, there's a lot of, there are a lot of small polar molecules in there, like creatinine and urea, and we will often, those can sometimes create capacity issues with the smaller sorbents, and we'll talk about that later. Let's go through the Oasis protocols now. They're very straightforward, especially for the reverse phase sorbents. This is for HLB. Basically, we load our pre-treated sample. The standard protocol is a wash with a low organic, in this case 5% methanol, and then we elute in 100% methanol. Obviously, these wash and elute steps can be adjusted to optimize our results, to clean samples up, make sure we're getting appropriate retention. We can also adjust the pH, but this is our starting protocol, and it's good for, you know, the majority of compounds. When we look at Oasis Prime HLB, as I mentioned, it has an extra sorbent in there to help with phospholipid removal. Again, it's a very similar protocol to the other one. We load our pre-treated sample, wash with low organic, and then elute in high organic. In this case, the combination of 90% acetonitrile methanol is required to make sure those phospholipids stay behind and don't get into your sample. So that may sometimes be an issue with some of the more polar polar analytes. But again, a very simple protocol, and it's easy to adjust the wash and elute steps as well. When we talk about optimization, often this is a sort of curve we're looking at. We're trying to find, you know, for a particular analyte or group of analytes, you know, what do I need to do? What's my the strongest solvent I can wash with to make sure that I don't wash them off of the sorbent? And when I'm eluting, what is this? What is it? We're sort of more interested in what is the weakest solvent I can elute with. So if you see here, we've pulled out our highlighted our optimum wash and optimum elution, and those are cases where we're well aware from this you know, inflection point where solubility is changing, and so we can easily, you know, we can do this experiment, look at different percentages, and we know, okay, here's where I can safely wash, and here's what I need to use to elute to get everything off. Here's a real practical example of this, where we looked at a benzodiazepine method on Oasis HLB. And on the left, we see our wash optimization. We've used from 20 to 80% methanol for the wash. And you can see up to 40% we're fine, but any more, 60 or 80%, and many of the compounds really start to fall off. And that's because we're losing them in the waste when we do that wash. Likewise, when we're optimizing recovery, here we've looked at a couple of different ones, 60, 80, and 100%. We see it, the blue at 60% does an okay job for the more polar ones, but not very good for the other ones, while the other two do a very nice job and give us, so our full recovery. So these are a simple example of how you can optimize some of these wash and recovery solutions when we're developing methods. So back talking now about the mixed mode sorbents. Again, on the left, we see sort of the structure of them. On the right, we see our OASIS 2x4 method development protocol. And this is really a protocol designed to simplify mixed mode method development. And so what we have our 4 mixed mode sorbents, OASIS MCX, WAX, WCX, and MAX, and 2 protocols. So the first one, we load our pre-treated sample. We have an acid wash, a strong. We can then wash with a strong organic solvent because everything is bound by ion exchange, and then we elute in high alkaline conditions. In this case, what we're doing for the wash, we are turning on. Basically, we're ionizing our sorbent or our matrix, depending. And then, so things will bind by ion exchange. And in the second elute or the final elute, we are turning off or removing the ionization from our compounds in our matrix. There's a complementary one with the other two, the weak cation exchanger and the strong anion exchanger. Again, for our wash and often our load, we do this under alkaline conditions, and this ensures that either the WCX, the weak cation exchangers, is charged, or in the case of MAX, our analytes are charged. Likewise, our elute is under acidic conditions that turn off that ion exchange and allow us to fully elute everything off the sorbent. But it's important to remember we're talking about ion exchange as well as reverse phase on top of that. So these are the 2 protocols for the 4 sorbents. And often we don't have to go through all of these. The knowledge of our the analyte we have will allow us to sort of often just go ahead and pick one. I want to talk quickly about retention maps, ion exchange retention maps. In this case, we're looking at one for the strong cation exchanger, OASIS MCX. It's a strong sorbent, so the sorbent is always charged as a permanent negative charge. So if we want to bind, for example, a weak base, when we lower the pH, we will ionize that base and it will be bound by ion exchange, as you can see on the left. This is great for loading and wash. And then when we're eluting, we will make things alkaline, turn off the charge, remove the charge on that base, and then we can elute it with a strong organic solvent to overcome the reverse phase retention. This is complementary. If we look at a weak exchanger, we see a similar retention curve, but in this case, what we're doing is we have a strong base that is always ionized. So what we do, we have to modify the charge on the sorbent. So in this case, when the sorbent is under alkaline conditions, it is ionized and easily binds the strong base. For elution, again, we acidify it, we turn off the charge on the sorbent, and we can use methanol to wash off our analyte. So again, we've got maximum retention when the sorbent is ionized, or in the previous case, when the analyte is ionized for that ion exchange retention. So to quickly review, OASIS HLB is a polymeric sorbent with a polar and hydrophobic retention properties. It's water wettable, gives excellent results for a variety of compounds. OASIS Prime HLB adds phospholipid removal to that, enables some simple, clean, and fast protocols. And the mixed mode sorbents and the 2x4 method are designed to provide a simple approach to ion exchange SPE when higher levels of cleanliness or analyte specificity is required. As I mentioned, it's crucial to understand ion exchange retention curves when dealing with this and developing these methods. I now want to quickly talk about recovery and matrix effects. These are some very critical portions of any extraction protocol. When we talk about recovery, we're talking about extraction efficiency. How successful was this method in isolating and recovering my compound of interest? If I put 10 nanograms in, do I get 10 nanograms out? Matrix effects is really looking at ion suppression. We're looking at the effect of the matrix on the ionization efficiency of our analyte. This is not recovery, that's very different. But we can do these two experiments together and often will during method development. But we want to know, have we removed any interferences causing ion suppression or enhancement. So that is matrix effects. And this is how we experimentally set these up. For recovery, you'll use an extracted sample similar to a calibrator or a QC sample where a known concentration is added to the matrix and then brought through the extraction process. We'll then compare that with a post-extracted sample in which we have extracted blank matrix and then added the appropriate mass of analyte after the extraction. So we're really looking at just the efficiency of recovery. When we do the matrix effects experiments, as we see on the right, we use our post-extracted spike sample, compare that to a standard solution. So we have the same amount of analyte. The only difference is the presence of the matrix components. And from that, we can use those values to calculate the matrix effects. Again, these are different experiments, but they can be done together. So let's quickly talk about sample pre-treatment and extraction, because before we start our extraction, we need to often do something to prepare our samples for the sample prep, if you don't mind that, Diction. Let's quickly talk about urine. Often pH adjustment is sufficient, especially if we're doing an ion exchange. When we're looking at urine, drugs and other compounds such as steroids may be conjugated. So we may have to deconjugate those chemically or enzymatically. Urine also has a high concentration of salts and small polar molecules that can create some issues for us. And when we're doing this, of course, we're going to adjust the pH before and after hydrolysis. Many of these enzymes have an optimal pH, and of course, we've talked about the pHing our samples appropriately. Can we hydrolyze urine samples? Again, we're hydrolyzing them to get rid of some of these metabolites, second phase metabolites. We can do chemical or enzymatic. Mostly these days, most people are using the chemical hydrolysis. You can use naturally derived enzymes, and lately there are recombinant ones that are very quick, very efficient, and do it at room temperature. So some good options out there. The important thing is, when we're doing this, we want to choose the appropriate enzyme and then optimize it for your assay in the lab. Don't always trust the manufacturer's claims. Whole blood and plasma, a little more common for this, for clinical samples. For whole blood, we talked about the fact that there's a lot of blood cells as well as high levels of protein and phospholipids. So often what we'll want to do is lyse cells with zinc sulfate or ammonium acetate, some combination, and then precipitate in acetonitrile or methanol, which will clean the sample and disrupt protein binding. At least 1-to-1, often you'll need 3-to-1 if drugs are strongly protein bound. We can then centrifuge, remove the supernatant, and then dilute it with enough aqueous to bring the organic down. That'll help us prevent breakthrough and allow us to easier load onto our SPE sorbent. But we do want to, again, take care of this. For plasma, it's a little bit simpler. We don't have the blood cells. We do have a lot of protein and phospholipids. At a minimum, we're going to dilute it with an aqueous buffer or modifier. That will help reduce viscosity, help with loading, and again, we're going to do a pH adjustment here as appropriate. If we do have to disrupt protein binding, there are a number of issues. Probably the most efficient and what most people go to is precipitation with organic solvent, methanol or acetonitrile. And this may be necessary if other treatments, such as the more mild ones like zinc sulfate or phosphoric acid, don't disrupt the binding. And of course, we're going to dilute and adjust the pH as with blood to make it appropriate for loading onto our sorbent. Here's a quick example of a protein precipitation optimization. We were doing some work on coenzyme Q10, which is very strongly protein bound. And so what we found is we looked at, everything from 3-to-1 all the way up to 8-to-1. And we find, many compounds are about 3-to-1, but in this case, we had to go all the way up to 6-to-1 to get full release and disrupt that binding. So if you have a very hydrophobic or compound or one that looks like it may be protein bound, this may be something you can do to figure that out. So now I'd like to talk about a couple of application examples, catecholamines and metanephrines, as well as some assays for endogenous steroids. So catecholamines and metanephrines, these are indicators of a number of neuroendocrine tumors. These are very polar compounds. They elute early and reverse phase conditions, and they can be subject to matrix effects in urine. Lots of early eluting salts and low molecular weight compounds there. They have some unique challenges. They're basic compounds, but they're unstable at high pH, so we're limited in what we can do pH-wise with our extraction protocols. And also for these, this assay, the matrix is acidified at collection to preserve the sample. It needs to be fairly highly buffered and can create capacity issues for an ion exchange sorbent. Taking a look at the properties of our molecules. As I mentioned, this is sort of the critical thing to do first, evaluate what you're working with. We see these are all fairly polar with low log Ps, and they're weak bases with pKa's around 9, every 8.8 to 9.5, so pretty much around there. So how do we approach this? Well, we can't use MCX because we, as you recall from the 2x4 method, we would need to elute under alkaline conditions for an cation exchanger. So what we can do is we can use the WCX, the weak cation exchange sorbent, and then modify the protocols. In this case, what we're looking at is a retention curve, and we see at about pH 5, we have the pKa of the sorbent. So above pH 5, our sorbent will be charged. And then below about pH 9, we have the pKa of our analytes. So below that, they will be charged. So when we're working with, even though it's for weak bases, we can use it, or for strong bases, we can use it for weak. And what we see is if we stick around pH 7, we have sort of the optimum area, optimum pH, where our sorbent is basically fully ionized and our analyte is analyzed as well. So if we take a look, they're just showing that it's locked at those neutral pHs. So what we do is we pre-treat and buffer with a buffered ammonium acetate solution at pH 7. So here is the protocol. We use a WCX plate. In this case, we're looking at a 60 milligram plate. The sample pre-treatment, as you can see, we're adding 1 mil of basically half molar ammonium acetate to buffer the highly acidified sample. We can then load that. We do a wash, again, at pH 7 to make sure that all our ion exchange is working properly, followed by a mil of methanol. And then we elute under acidic conditions. In this case, we're using a Hillock chromatography, so we eluted an 85% acetonitrile. Let's go through these. Here's an example of why we needed that higher sorbent. So from the left, the upper left-hand corner, we see we're using a microelution plate with a 2 milligram bed and 100 microliters of salt, of analyte or of sample. Pretty poor recovery. It's a little better with the 10 milligram plate, even better than with the 30. And then finally, 60 milligram plate is really, we've got all the capacity we need for very good recovery, high recovery and efficient recovery for all of the analytes. So what are the results? Here is a graph of recovery and matrix effects. This is actually originally done with 30 milligram. We looked at the 60 later. And you can see good consistent recovery and then minimal matrix effects for the Hillock mode in orange. We also looked at it in reverse phase and they were a little higher, but for this assay, matrix effects were very small. So quantitative results, we get good curves. They're linear and accurate for all of the compounds, showing here Normet and epinephrine, as well as accurate and precise QC results, which you can see in the tables to the right. So to summarize, we used a mixed mode sorbent, WCX, for retention and selectivity. Controlling the pH enables adequate retention while avoiding analyte oxidation that we would get at those higher pHs. And as I mentioned before, knowledge of the analyte and the sorbent pKa is critical for this. And of course, larger formats can be used to compensate for high ionic strength of samples and buffers. Now I would like to talk about some applications for endogenous steroids in plasma. Our team's developed a number of application notes and methods over the years, and so I'll be talking about those and a couple of different approaches to that. So this is a graph of the steroid hormones. It's a steroidogenesis pathway as well. And you can see from cholesterol, there are the pregnenolones in yellow, the androgens down towards the bottom, the estrogens to the lower right, and then the upper right, we've got the mineralocorticoids, and they're defined and grouped by their structure and the number of carbon atoms as well. So when we're looking at endogenous steroids in plasma, we found that there are a number of options that can be used. They are non-polar, so of course, Oasis Prime and Prime HLB are appropriate, but we can also have used a mixed mode exchanger, Oasis MAX, add some additional cleanliness and selectivity, and I'll show you how that works. Let's talk about MAX first. As I mentioned, even though it's an ion exchanger, they are all built upon the HLB backbone, so it's got that base that, you know, the sorbent itself is that reverse phase copolymer. So it's not just the ion exchanger. So in this case, what we're doing, we're using the MAX to sort of clean it up a little bit more. We look at our sample pretreatment. We have our sample with internal standard. It's precipitated and then diluted with water, as we mentioned, and centrifuges. Then we load it onto the plate. We do the high pH wash for this plate to clean it up, and then elute with methanol in 50 microliters of water. In this case, these are non-polar, they're not bound by ion exchange, so we can just elute them in straight organic. And what does this give us? So in this specific case, Oasis MAX removed an interference that was observed in the testosterone qualifier trace that could potentially affect the ion ratio. So here we're seeing 3 traces. On the bottom, we see MAX, and there's no interference. But in the other 2, with protein precipitation and Oasis HLB, there's an interfering peak there that could compromise our quantification. So we're able to, by using selectivity, to get rid of that. And this method gave us very good results, good linearity and accuracy, as well as precision for the compounds that we were interested in. All right, I'm going to go switch gears a little bit and talk about reverse phase analysis. Again, there's a number of different panels, and we've come up with a couple of ways to do this. So this is one method developed several years ago, where we're looking at 17-hydroxyprogesterone, androstenedione, and cortisol using Oasis Prime HLB. So our extraction methodology, if we look here, we are precipitating our sample and then diluting it as normal. We then load our sample onto Oasis Prime. We do a wash with 25% methanol. This had been optimized to make sure we left everything on there, but clean it up as much as possible. And then we elute, and we're using a microelution plate, so we can use these small volumes in basically 50 microliters of 9010 acetonitrile and methanol, and then dilute it with water. And as you may recall from earlier, this is sort of the elution solution for Oasis Prime that really cleans it up and leaves the phospholipids behind. Taking a look at these results, recovery and matrix effects, we're getting 70% recovery, very good, very consistent with low RSDs, very minimal matrix effects as well, are all under 20%, and a couple of them are negligible. And on the right, we're just showing residual phospholipids on the bottom from a protein precipitation, and on the top, using Oasis Prime, we get rid of about 95% of those. So a very clean and efficient and simple method. And that gives us, if we look at the quantitative performance, very good linearity and accuracy for our calibration curves, and an excellent accuracy and precision. All RSDs and accuracies are within 10% for all of the 3 analytes we were looking at in this method. So the next one is we're looking at a sort of a larger panel of steroids in plasma, and this includes DHEA sulfate as well. And this is a slightly different approach. We are using Oasis Prime HLB, but a little different way of approaching it. So quick note, this is a panel. One of the things during this application note is I mentioned how chromatography can be important. And in this case, we use it when we can see using the HSST3 column, we're able to get rapid results, but also the more important thing, we're able to separate all of the isomers that may interfere with each other. You can see especially the deoxycortisol, 11-deoxycortisol, as well as some of the other compounds. So everything is baseline separated, which helps us with precision and accuracy. Here is the method that we use. The sample pretreatment is fairly similar, where we are precipitating with methanol and diluting with water. However, in this case, using the Oasis Prime microelution plate, we do it a little differently. Some of it's the same, we just load it, the supernatant onto the place. But then there's two wash steps, one with a little bit of ammonia and one with a little bit of formic acid. And what that does is what we're doing is we can use these two different washing at two different pHs to hopefully, ionize or deionize basically anything that could possibly interfere with our analytes of interest. By changing the pH, we can make them more polar, so they're easy to wash off the sorbent. But since we're only doing it in 35% methanol, all of our compounds of interest, like our steroids, will stay behind. Then we can go ahead and elute with 85% acetonitrile and methanol and dilute it with water.
We lost the sound. Okay, well, John is trying to get his microphone back online. No. I'm very sorry about this technical issue.
How about now, Godo?
Yeah.
All right.
All good.
Thank you all for your patience. We'll get through this, I promise. So Reduced phospholipids was HLB prime, and then down below we're looking at the signal-to-noise comparisons for the various steroid hormones, and you see Oasis prime gives a good results for all of them. I'll try to move through this. This is just showing how Oasis DHEA sulfate it's very poor recovery on MAX or LLE, but excellent recovery in signal noise on HLB prime. Looking at our method performance, good analytical sensitivity with low CVs at the LLO2, and on the right we see low concentration chromatograms of the low standards. Looking at precision between day, between batch, and within batch, and excellent precision, all in single digits for the three QC levels over a number of different days. Likewise, external quality accuracy, very good regression fits, very little bias, and again, all the biases were below 10%. And just one more looking at testosterone accuracy. Before we cut out again, to wrap up, the matrix and analyte both need to be considered when we're doing a SPE or any sample prep method development. And different matrices have different considerations, such as capacity and pH adjustment for the CATs and METs. For the plasma and serum steroids, we have phospholipids, specificity, and sensitivity, as well as we need to get rid of protein binding as well. And so some of the advantages Oasis for clinical research method, really we're talking about cleanliness, selectivity for HLB and mixed mode sorbents, as well as universal starting protocols and clearly designed methods to allow you to optimize and quickly get to a clean, efficient sample prep method. So thank you. I apologize for the issues. Godo, take it away.
Well, thanks, John. So we have a few questions in the question box, so you can still stay online, John. So we do have a first one, which is about applications for the extraction and concentration of fat-soluble vitamins. And then an additional question related to the same topic, which columns would you propose for vitamin A, D, E, and K? I don't know what you did, Jonathan, but I mean, you took off the headset, and then we lost you. So no, I don't know. I mean, no. You're gone. So, well, yeah, I can repeat the question, but I mean, you cannot answer. So, so you know what? I think what we'll do is we'll send the answers to the questions that have been typed into the question box. If you have any further questions, please type them in, and we'll answer them after the event. To the email address, of course, that you have entered when you connected. Sorry again for these technical issues. First time it happened, but there is always a first time for everything. Thanks for your patience, and it was great to have you here. We have further sessions tomorrow and Thursday, and hope to see you there as well. Thank you very much, and see you soon. Bye-bye.